And with that, we'll keep moving forward. So next we have a presentation by Frida Espinosa from the School of Human Evolution and Social Change at Arizona State University. And this will be a continuation of this exploration of this current population that we just heard about. And so the title of her talk is Convergent Fears, Transnational Determinants of Health of Pregnant Latin American Immigrants During the COVID-19 Pandemic. Welcome, Frida, and thanks for sharing your work with us today.
Hello, my name is Frida Espinosa Cárdenas, and I am a doctoral student at the School of Human Evolution and Social Change here at ASU. I am grateful to be here today and to the co-authors of this presentation. Latin American mothers in this country continue to be underinsured or uninsured, mainly due to the types of essential work that women do and the lack of protections offered to them. Women who qualify for access but lack permanent or legal status rely on the Federal Emergency Services Program, which grants temporary access for labor and delivery only, or in other circumstances for emergency mental health services. COVID-19 has restricted services even further for this population. Parting from social determinants of health, in 2015, Dr. Heidi Castañeda and her colleagues made a call to look beyond the traits that often are used to explain immigrant health outcomes, such as individual behavior and level of acculturation. She concludes that examining structural factors fosters a social determinants approach to immigrant health, and this in turn compels public health practitioners to support policy and programmatic interventions rather than just individual ones. Transnational determinants of health responds and pushes the conversation to say that social determinants go beyond one place and time, saying, yes, let's look at structural barriers, but don't forget how home country conditions, as well as the migration experience itself, contributes to health outcomes. Hence my research question: how can perinatal experiences of Mexican and Guatemalan mothers who gave birth during the COVID-19 pandemic inform programs and policies supportive of immigrant families? As a feminist scholar activist, it is vital for me to recognize my positionality in relation to the participants and the research process. Unlike many of the study participants, I was educated in this country but had the privilege to study and work in Mexico, making me a native Spanish speaker and bilingual professional. I am formally undocumented and an immigrant rights advocate, which allows me to build rapport quickly with this population and pick up on subtleties about living in Arizona without legal status. I was a prospective doctoral student at the time of this study and also the translator of this survey. So in summer of 2021, I interviewed the 35 Spanish-speaking participants over the phone using the Qualtrics survey previously described. I analyzed the text of 10 open-ended questions and identified domains and themes. In order to identify structural barriers specific to this population, I implemented an intersectional lens that allowed me to recognize the various forms of marginalization that immigrants or transnational birthing people faced during the COVID pandemic. All participants gave birth between May and December 2020 at the same birth facility. 11 Guatemalan and 24 Mexican mothers participated. I was personally not expecting such a high number of Guatemalan participants, but this speaks to the national, ethnic, and linguistic diversity of the Latinx immigrant communities in Phoenix. Although we did not systemically collect this information, and it is not recommended to do so, a few participants reported being undocumented or having a mixed status family, meaning within one same unit, meaning that within one same unit, family members could be undocumented, have a temporary status, or be U.S. citizens. 14 participants also reported 14 participants, reported having emergency access and having it as their only form of health insurance. Only one mother reported that she had insurance through her employer. These three groups of findings were identified in the previous presentation. I will focus on the intersecting findings that describe the challenges transnational families face. Here I highlight three intersectional findings. The first is the fear of being alone during a birth due to COVID restrictions. This fear was rampant amongst study participants. However, this mother, the fear that this mother faced was amplified because of the language barrier she knew she would face if she was left alone in the OR. My husband asked if the C-section was necessary. He told them she wants to have a normal birth. I asked him again, "Are you going in the OR with me?" I do not speak Spanish or English. My husband told me, "I can't go in," but I told them, "I won't go without you." My husband told them again, "She doesn't speak Spanish." Finally, they said, "Okay, you can come in." I speak Mam. This language does not exist here, only in Guatemala. The second intersecting finding was the fear of a parent contracting COVID due to the lack of supports, due to the lack of support systems, but amplified by knowing the older child does not have any type of health insurance due to being foreign born, and also the financial implications of that, especially at a time when the family income was significantly reduced during the pandemic. I was more worried than anything that my partner would get sick because it's just him and me, and that my daughters would become infected. My oldest daughter does not have insurance because she was born in Mexico, and when I take her to the doctors, we always have to pay. My partner's work hours decrease, so that worried us. The third example illustrates how themes intersect to amplify financial hardships, especially if the mother is an undocumented worker, or does not have access to care after leaving the hospital where she delivered her baby. It helped a lot when they would come to the apartment to serve breakfast. Without documents, it is difficult to make enough even for food. I get stressed when I see the amount of food in the fridge becoming less, or when it's time to pay the rent. So this is another quote that illustrates the intersecting themes of financial concerns, food security, and being an undocumented parent. This is just a tiny sample of the study findings, demonstrating the challenges and the fears that transnational families have faced during the COVID-19 pandemic. The implications are many. This study demonstrates transnational determinants of health should inform services within the birthing facilities, but also outside of the facilities, especially within the postpartum period. The urgent need for adequate, culturally sustaining, language-accessible health information, COVID-19 health information, and specifically information about how it's transmitted and the implications for pregnant women and breastfeeding women. This study also demonstrates the need to extend medical coverage for a year after birth. SB 1272 would allow this extension. I don't have clarity if SB 1272 would also extend emergency access, but it is both of these programs are in urgent need of extending. Lastly, although the study highlights challenges and deficiencies amongst immigrant communities, community cultural wealth and assets should always inform programs and services that cater to immigrant or transnational families. Thank you very much.
Thank you for that great talk, Frida. We can now open up the floor for questions. Please type them in the chat as you have them.
I'll go ahead and start with Kate Dobler's question. I'd actually like to talk about a little bit more about what the implications of SB 1272 would be for those that depend on emergency access. So if you have the answer to that question, that would be great to know. But I do want to say that we have received additional access from Valleywise Health to go into the patient records and be able to determine what was their financial eligibility at the time of the birth. That way we can determine, what type of insurance people had, participants had, and specifically how many of the Spanish-speaking participants were depending of the Federal Emergency Services Program, which is emergency access here in Arizona. I'll speak to Laura Moore's question as well. Part of my presentation, as you heard, is being somewhat representative of the community that you're engaging in research. And so this is very important for me as a researcher now in this new doctoral student position that I'm in. I think that was why I was able to be so successful in recruiting and being able to first, text. We texted people, and then as soon as they replied, then I would call them at that same moment, and then I would have a conversation with them in Spanish informally, just telling them about the survey, and then also make an appointment. So obviously there's always no-shows, but the majority of people that made the appointment with me did stick to the appointment time, and just trying to be as personable as possible in order to engage them and talk about also maybe the implications of what their their experiences can be for themselves and for other women.
Looks like Kate has another question for you, Frida. She says, was there a difference in the availability of culturally relevant care prior to COVID for immigrant communities? And has the availability of care been more scarce across time?
Well, this study is not able to kind of respond to this question because it was specific to the middle of the pandemic when women had their babies during the first year of COVID. But this is something that definitely this study highlights in terms of the need for culturally relevant care, and also the type of models that that Valleywise is implementing and has implemented. For example, the cultural health navigator model, which really made the data collection for with the refugee women successful because they already had that prior relationship. And so, exploring ways in how we can use a cultural health navigator model with other populations, specifically Latin American populations, would definitely be a recommendation. And what do you have making patients feel more comfortable answering questions? Yeah, I mean, Laura, this is a great question in terms of what are your recommendations to make patients feel more comfortable. I mean, I think the reason I highlighted that I'm a fully transnational, fully bilingual professional, I think is key, because people pick up on those subtleties when maybe Spanish is not your first language, and how they're able to converse with you and talk more openly about their lives. Also, this is a statement that is too generalized, but in terms of identifying that your accent is is similar to the accent that they might hear in their home country, and maybe building that cultural trust very quickly, also allows for them to be able to say, like, I don't have papers, and this is why it's also really difficult. It's a very, very tricky question. It's a great question, and it's something that I would like to keep exploring, because it is, ultimately would like to be able to have, make recommendations of how we can best engage undocumented populations, especially as researchers, in order to be, most better informed in terms of how to serve this population, especially within this context of COVID.
Thank you so much, Frida. It's really amazing work and super great discussion that we're all having around these important topics.